Hey guys, hello and welcome to Speedy Medical. In this video, we are going to take on the follicular carcinoma of the thyroid gland. If you haven't watched our previous videos in which we talked about the basics of thyroid gland, do watch the video first and then resume this video. The follicular carcinoma of thyroid gland is the second most common type of carcinoma, and the first most common is obviously the papillary carcinoma of thyroid. The follicular carcinoma arises in the patients where there is iodine deficiency, and it is the most common type of carcinoma arising in the areas of iodine deficiency. It is believed that the iodine deficiency it leads to the formation of what is called as multinodular goiter, and the multinodular goiter is a precursor lesion for the formation of follicular carcinoma. So as a result of the iodine deficiency, there will be the formation of multinodular goiter, and this multinodular goiter will lead to the development of follicular carcinoma. So this is the basic of the pathogenesis. Now if we talk about the histopathology of the follicular carcinoma, when we look at the sample of the tissue of follicular carcinoma, then it is seen that there are numerous malignant proliferation of the follicles, and the characteristic feature which differentiates the follicular carcinoma from the follicular adenoma is the invasion through the thyroid capsule. Now there is a fibrous capsule which is called as the thyroid capsule, and this follicular carcinoma, the cells or the follicles, they will invade through this capsule, and this capsule invasion is the characteristic feature of follicular carcinoma, and this capsule invasion is present only in case of follicular carcinoma, while it is absent in case of the follicular adenoma. Talk about the presentation of follicular carcinoma. Like the papillary carcinoma, the follicular carcinoma is common in females, and the female will present with a solitary nodule which is enlarging over time. So there will be a solitary nodule that is increasing in size over a period of time. Now what is the next best step in the management of this case? As you encounter a patient with this feature, you will order a biopsy or fine needle aspiration biopsy of thyroid gland. So in the biopsy sample, you will look for whether the lesion is papillary or it is follicular. Let's say that it is follicular, then you are sure that it is some follicular lesion which may be adenoma or which may be carcinoma. And to differentiate whether it is a adenoma or carcinoma, you will just look for the capsule invasion. If the capsule invasion is present, that means you are sure that it is a case of follicular carcinoma. So this is the whole idea of the diagnosis of follicular carcinoma. Now another thing about the follicular carcinoma is that unlike the papillary carcinoma, in which the metastasis they tend to be through the lymphatics, in case of follicular carcinoma, the metastasis is hematogenous. So the follicular carcinoma, it will show the hematogenous metastasis, and the papillary carcinoma, it showed the lymphatic metastasis. Now let's talk about the treatment of follicular carcinoma. So obviously the treatment of follicular carcinoma will depend upon the size of follicular carcinoma and the site of follicular carcinoma. Let's say the size of follicular carcinoma is small, then the treatment will be lobectomy, in which we will remove the lobe of the thyroid gland which is harboring that lesion. But for example, if the size of follicular carcinoma is large or it is big, then the treatment would be total thyroidectomy. Also, if the follicular carcinomas are at multiple sites, then also the treatment would be total thyroidectomy. So this was the whole idea about the follicular carcinoma. I hope you like this video. For more videos like this, do subscribe to our YouTube channel.